Today, we're talking about the nursing shortage. So a lot of you have followed this channel for some time. You've seen the videos about advocacy. We've been bringing up stories. We've been talking about what's going on in healthcare. And we wanted to start out to put longer videos of what's actually happening in healthcare and add some additional context so you can learn along about what's happening in the system and how we can improve it. And we've been talking quite a bit about staffing ratios, shortages, strikes, everything that's happening right now in US healthcare. And so this little bit longer form video is to give you a quick education, no longer than 5 minutes, to get up to date on what exactly is happening with the nursing shortage. Why do we call it a shortage? Is it a shortage? All of the nuance that comes along with it. And I wanted to make sure that we took some time to really explain this in depth. So if you like this video, please comment, subscribe, just give us every little bit of encouragement to keep this going, and we'll make sure to keep on pumping out videos just like this. All right, so the nursing shortage, what is it? What's the shake? Let's start with some data. Number one, are we or are we not in a shortage? So if you actually look at the numbers, in 2022, the American Hospital Association, the AHA, reported that an additional 500,000 nurses were leaving the workforce at the end of 2022. The 2023 numbers are not yet in, but they expect that that number increased year over year. And at the end of 22, that brought us to a shortage of over 1.1 million nurses in the US. Another study done by the AHA's partner said that for the first time ever, we saw a decline in the amount of new nursing students in the US from the year prior. So that means that less and less people are signing up to become nurses in the US for the first time ever. So that was like a 20-year trend that we're now going in the opposite direction. On top of that, it looks like nationwide for 2023, 11.1% of all available nursing jobs went unmet. So if you look at those numbers, it paints a picture that we are indeed in a shortage. But that's become a controversial term, right? And the reason why is because of staffing ratios. So staffing ratios are essentially the amount of healthcare workers present for the amount of patients that are currently there. So like 1 to 5, that's one nurse for 5 patients, right? And so those ratios have been increasing and increasing. And that's putting more and more strain on our healthcare workers, and it makes it really difficult for them to function properly, right? It's more strain on less resources. And so staffing ratios have been increasing and increasing and increasing. Some states have implemented laws and regulation to make sure that staffing ratios never pass a certain point for certain facilities. But there is no nationwide rules around that at this point. So if you ask a nurse if there's a nursing shortage, they say, absolutely not. There are plenty of nurses, but there is a shortage of facilities that are willing to change their staffing ratios. So it's not really a shortage, it's just that the staffing ratios are increasing and increasing. We know that to be true. On top of that, in 2023, we saw some of the most amount of strikes by nurses and healthcare workers across the US than ever before. It was a banner year for protesting and going on strike. I believe that the Kaiser strike in the fall of 23 was the largest strike in nursing history, and we saw that that actually worked very well in favor of the nurses. So we have more strikes, we have staffing ratios that are increasing, we have enrollment decreasing, right? We have the data that shows that more and more nurses are leaving the workforce. Let's go into another layer of nuance. Below this, nurses also don't like to say that it's an actual shortage because on top of the staffing ratios, they're saying it's not a shortage, just treat us better. We wouldn't be in a shortage if in the first place we were paid appropriately, right? If we had appropriate staffing ratios. If we had enough people on the floor, if we had enough MAs and others to be there to assist us. And so at the end of the day, it's really kind of this complicated topic of if there is a shortage, if there is not. I think in general, we can all agree on this. We need more and more new nurses in this field to make sure that those that are aging out of the workforce, as well as leaving the job because of these poor ratios, it's going to put the US in a really tough position if we don't figure this out. And so we can focus on some of the ways to improve this, right? So let's talk about the potential solutions. As I mentioned, some states have rolled out mandatory staffing ratios. If that became nationwide legislation, we could actually make movement in the amount of nurses required to be on staff, and that would actually probably save the amount of nurses that are also leaving the workforce at any given time. On top of that, besides nationwide legislation on staffing ratios, we could focus on nurse pay, right? This seems to be the big topic that most healthcare workers are focused on. If you look at the amount of pay that our healthcare workers are getting versus the work that's going in, the hours, and the amount of school that goes along with it, there's a really good argument that we need a better facilitation, both by record profit years for these healthcare facilities and the workers themselves leaving the workforce, right? Maybe an easy way is to increase the amount of dollars. But those that sort of say, it's not a money issue, it's more about we need to have more people entering this field. So a big topic right now around the nursing shortage is about immigration. If we were to set up visa programs for those outside of the US that are highly trained, highly skilled, willing to also participate in nursing programs to learn how to become a nurse in the US, then we could solve this issue. So immigration seems to be the 2024 highlight of how we're going to get out of this. But for now, it's not so clear what's going to happen when it comes to the nursing shortage. But in general, the US needs nurses. We cannot be in a shortage of healthcare workers, right? I think everybody can feel across the US, healthcare, health in general, is becoming more and more of a present fact in all of our lives. And as we're coming up on this election in 2024, it's going to be really important for whoever it is that ends up in office to take the time to consider the issues of our healthcare workers and to consider the issues of this nursing shortage. And I think we can all say it needs to happen. So thank you very much for the time. If you like this video, please like, subscribe, give this page a follow. Follow us on TikTok, follow us on Instagram, listen to the podcast, these longer form YouTube videos. We really appreciate all the support. And to all of our healthcare workers out there, thank you so much for everything that you do. We'll see you soon.